Hi guys, this is Henry Hoffman. I'm an occupational therapist and co-founder of Saebo. Welcome to my Q&A video series where we are answering questions that therapists send in hopes of helping them out and giving them some special tips. I have a very good question from an OT and it reads, my patient suffered a stroke 5 years ago and has no use of his affected hand. He learned about your technology online. I would like to give it a try. Since he is 5 years post-stroke, is he still a good candidate for any of your products, and if so, which ones? Absolutely, it's a good question. When I look at the neurorehabilitation field over the last 2 to 3 decades, if I was asked that question 2 to 3 decades ago, my answer probably would have been no, there's probably not a good chance for recovery. Remember, this was the time when health professionals were saying that the patients had plateaued, or there's no further progress that the patient will make. And so, for the most part, that was actually true based on the treatment, the standard of care that was provided at that time. Thankfully, with the advent of new treatment techniques and treatment interventions, patients are able to curb that plateau and more progress can actually be made with the right tools and the right therapist. Our company motto is no plateau in sight. We feel the patients do not actually plateau. It's actually the treatment options have plateaued or failed them. So just this past May, there was a really good article in the Journal of Neurophysiology that was published about a gentleman who was 23 years post-stroke, and he couldn't use his hand for 23 years. And then he was fit with the Saebo-Flex device. And for 2 years, he was grasping and releasing, practicing with the Saebo-Flex. And after those 2 years, he actually had a hand that became functional. So imagine that, how meaningful that is. No function for 23 years. After the Saebo-Flex, function. And that goes against what the research community has been preaching for a long time. And so they feel that it's unlikely that a patient will actually get their hand back or make more progress. We don't feel that way. We hope that opens up the clinical debate, that article, and now allows us to rethink things, regarding plateaus and stroke outcomes. So to answer the OT's first question, yes, your patient's a candidate even if they're 5 years post-stroke. And to discuss the second question, which is what type of products, I would first want to get that hand involved as soon as possible in a functional way. And that would either be with the Saebo-Flex or the Saebo glove. If the client has a lot of tone, more than mild tone, I would go with the Saebo-Flex. It's more of a high-profile outrigger system, and it's more durable, so it can handle spasticity. If the client had low tone, then I would consider the Saebo glove. It's more of a low-profile product. It allows clients to pick up various size objects. You're just dealing with less tone, so it's going to be a little easier to work with those clients in general. Now, other products to consider, I would definitely be doing an NMES or FES. I like to do electrical stimulation in conjunction with the Saebo-Flex. I could do it with the Saebo glove. I also like to use E-stim with the Saebo stretch, where you're actually stretching the long finger flexors while stimming the extensors. And that's a phenomenal way to really reduce spasticity using a technique called reciprocal inhibition. And also start working on some strengthening of the finger extensors. As far as other products, I would definitely be looking at the Saebo Stim Micro, which is used as a low sensory stim program to decrease edema, increase sensation, decrease spasticity, decrease pain, improve corticomotor excitability. It's a phenomenal product for inattention or neglect or RSD. So I would definitely be adding that. And of course the Saebo Stretch, which I mentioned earlier, to manage the soft tissue shortening and to prevent contracture. So when you think about all these different products, you're thinking about affordable products that are either reimbursable or accessible because they're low-cost items. And if the patient has proximal weakness, don't forget about the Saebo Glide Plus. It's a great product. You get the hand strap. It allows them to work on shoulder and elbow movements at home. They can do that in addition to electrical stimulation or by itself. So there's a really good comprehensive program that clients can receive, ranging from hand devices to shoulder devices. And for that question from the therapist, just because they're 5 years post-stroke, that does not matter. You can still make progress. There's a lot of videos on our website and a lot of patient testimonials and stories. You'll see these patients are not fresh, acute, subacute clients. These are chronic stroke survivors that made these gains. So the opportunity really exists. And imagine what happens. You take a patient that comes into your clinic, no hand function whatsoever, and just in a matter of minutes, you're giving him the ability to use his hand for the very first time. That's pretty powerful and meaningful. So I hope that question is helpful for you all. Thank you for listening to this video series. And just remember, no plateau in sight for any of your clients.